Good day, my name is Francis Camilo Espolo, a BSN student from Visayas State University. Today I'm gonna perform newborn care. So what is newborn care and why is it important? So newborn care is where the babies have the right to be protected from injury and infection. It is for them to breathe normally, to be warm, and to be fed. All newborns should have access to essential newborn care, which is the critical care for all babies in the first days after birth. Now, we're going to discuss the proper positioning of the newborn within the 90 minutes of non-separation from the mother. So first, we must position the newborn in a prone position at chest. Then, the newborn's neck is not flexed nor twisted. Then the newborn should be facing the breast. Then a newborn's body is close to the mother's body. Then the newborn's whole body is supported. So for the pharmacology of Graves' prophylaxis or the erythromycin ophthalmic ointment, it is classified to be a topical antibiotic. So the dosage for this is up to 0.5 to 1 centimeter HI. Then for the possible adverse effects is a mild irritation to the conjunctiva, slight blurring of vision. So its action is effective against gonorrhea and chlamydia organisms. For the pharmacology of the vitamin K, the dosage should be at 0.5 to 1 milligram. So the adverse effects is the local irritation such as pain and swelling at the injection site. Its action is used to prevent and treat hemorrhagic disease in newborns, necessary in the component for the production of certain coagulation factors and is produced by microorganisms in the intestinal tract. So next is the pharmacology of the hepatitis B vaccine. So it's classified to be a topical antibiotic. Its dosage is up to 3 doses, which is given immediately at birth, then after 1 month, and after 6 months of life of the newborn. So the possible adverse effects of the Hep B vaccine is sore leg from the shot and a low fever less than 37.8 degrees Celsius. So Unang Yakap is the campaign to spread the use of essential newborn care. There are 4 steps of Unang Yakap. First is the immediate and thorough drying of the newborn, in which here immediate and thorough drying for 30 seconds to 1 minute warms the newborn and stimulates breathing. Second is the early skin-to-skin contact between mother and newborn and delayed washing for at least 6 hours to prevent hypothermia, infection, and hypoglycemia. Third is a properly timed cord clamping and cutting. Here it prevents anemia and protects against the brain hemorrhage in premature newborns. This means waiting for the cord pulsations to stop from between 1 to 3 minutes. Lastly is the non-separation of newborn and mother for early breastfeeding. Here is the continuous non-separation of newborn and mother for early breastfeeding. Breastfeeding protects infants from dying from infections. So the first feed provides colostrum. Now we're going to don our mask and cap properly. This is to prevent contamination. First, we're going to introduce ourselves to the patient to establish rapport. And hi, good day ma'am. My name is Francis Camilo Espolo, a BSN student from Visayas State University. I will be your nurse for today. And may I ask your name, ma'am?
Abigail
And when is your birthday?
May 20, 2000.
Okay, thank you, ma'am.
Now, perform hand washing, the 1, 2, 3, 4, 5 count in each movement to prevent spread of contamination.
Now we're going to prepare the necessary materials needed for the newborn care procedures. We're going to assume that this is the erythromycin ophthalmic ointment, then assume that this is the hepatitis B vaccine. Then here is the two tuberculin syringes, then the aspirating needle, and the cotton balls, the wet and dry.
Now check the 10 rights of drug administration, which are the right drug, right patient, right dose, right route, time and frequency, documentation, history and assessment, drug approach, and right to refuse, drug to drug interaction and evaluation, and education and information.
Siyempre,
Now I'm going to don my OR gown and also my gloves. This is no reclamation. Now we're going to perform eye care. First, we're going to gently pull down the newborn's lower eyelid and then extrude a line of ointment length to the lower eyelid from the inner canthus to outwards. Then sa other side. Okay. And discard any remaining ointment. Now we're going to close the eyelids of the child and count to 5 to allow absorption of the ointment. 1, 2, 3, 4, 5. Then now we're going to wipe the excess ointment from the child's face using a dry cotton ball. Then other side, from inner to outer, going to wipe the excess ointment. Now for the hepatitis B vaccination, we're gonna use our tuberculin syringe and withdraw 0.5 ml of Hep B vaccine. After withdrawing, I'm going to wipe the side of the child's anterolateral muscle here at the thigh and administer the Hep B vaccine. And now discard the used tuberculin syringe. Now for the vitamin K administration, we're going to take our tuberculin syringe and take at least 0.5 milligrams of vitamin K. After that, we're going to use a wet cotton ball and wipe the skin at the thigh of the antilateral muscle of the child. In which we're going to inject the vitamin K. Now we're going to inject the right side of the thigh where the anterolateral muscle is located. And then discard. So after administering the vitamin K, we're going to assess for signs of bleeding to the newborn, and then we're going to check the newborn's condition and vital signs and perform aftercare. After the checking the newborn's vital signs, we're going to document the name of the drug and vaccine, time, amount, and route of administration, nurse's name and signature, other nursing interventions done, and report any unusualities to the physician or the resident on duty. So next is bathing the newborn, which will be performed after 6 hours post-delivery of the baby. So post 6 hours of delivery is the safe time for the baby to be taken a bath to avoid hypothermia and promote extended skin-to-skin contact with the mother. Now we're going to prepare the necessary materials needed for bathing a newborn. Now, I have here the basin of water, the washcloth, the towel, and then here the clean diaper, the baby's cloth, and that's all. For assembling these items beforehand, it is not so that the baby is not left exposed or unattended while you go for more equipment. Next, we're going to prepare the room, and then we're going to assume that this room is warm for about 24 degrees Celsius. Then prepare the water, and the water should be approximately 37 degrees Celsius to 38 degrees Celsius for thermoregulation. Now we're going to bathe the baby from the cleanest to the dirtiest. First, we're going to wipe the newborn's eye with clear water from the inner canthus to the outer canthus, and use the green portion of the washcloth for each eye. This is to prevent the spread of infection, not HI. Then we're going to wash the face with clear water only to avoid skin irritation. Now we're going to hold the baby like this, then wash the baby's face using soap and water. The baby's hair using soap and water, assuming that the baby's hair is wet. Now we're going to use we're going to place the baby now, then wash each part of the body. Make sure not to soak the umbilical cord. Now we're going to wash the genitalia of the baby, especially for women, and wipe it from front to back. This is to prevent contamination of the vagina or urethra by rectal bacteria. After that, we're going to put the pampers to the baby. And put the baby's clothes. Lastly, wrap the baby from the towel, using the towel. And this is how I finish bathing the baby.